But first, there is hope that a new type of medicine called gene silencing could help those suffering with Parkinson's disease and Alzheimer's.
It works by fine-tuning the structures of our DNA, and it's already been successful in reversing a rare genetic disorder called porphyria. It's something our next guest, Sue Burrell, suffered with for many years before taking part in a clinical trial. She joins us now. And our health and science correspondent, James Gallagher, is in our London newsroom as well. James, we'll come to you in just a moment. I guess in order that people can understand why this matters so much, just tell us about what the condition you have and what's changed.
Okay, so I've got acute intermittent porphyria, which is one of various porphyrias, and they work, there's a problem in the way that I produce heme, and as a result of that, I end up with toxins in my body.
Okay, so one step back.
Yeah.
The way you produce heme, as in hemoglobin?
Yeah, so the red part of your blood, and which is necessary for everything that your body does in every action that it takes.
So that helps pain?
Well, what happens is I have a problem producing that, and as a result of which I end up with toxins in my body called porphyrins, and these porphyrins cause intense pain, they cause sickness, and if untreated, cause paralysis.
So how does that emanate in everyday life with you?
Significant pain is one of the biggest elements for me, so it fluctuates. I'll have low-level pain a lot of the time.
Where?
And then it starts in my legs, in my back, and gets really intense when you're having a really bad attack, where things like intravenous morphine doesn't get rid of the pain.
So tell us about what's changed.
Okay, so I've been on the drug for a good few months now, so it's a placebo-controlled study, so the first part didn't know whether I was on the drug or not, and nothing changed initially, and I have now seen a significant change. I'm not having recurrent attacks, and in the UK there's about 50 to 100 people with this kind of symptoms, and I have no pain, and I never ever thought that I may live a life with no pain. I've had it for 10 years. And sometimes it would be low level, but a lot of the time it would escalate. And I was on strong opiates every single day.
And we'll talk about how it impacted your life, actually, in terms of job, house and all that in just a moment. But I think we should talk to James. And James, get you to kind of explain the science, because it goes to our DNA, changing what, a gene in the DNA makeup?
Okay, so what's going on here is that this technology essentially works a little bit like a librarian going shh inside a library. So if you have too much of a toxic protein, that's like having noisy, raucous kids inside the library. Now, this drug goes in and stops the production of some of the proteins that are involved. So it lowers the levels of toxic proteins inside the body. And it does it by changing the way that DNA works inside the body. It doesn't actually alter our genetic code, but it changes the way it's interpreted, fine-tunes it to alter the levels of proteins in the body so that Sue doesn't have those same toxic proteins causing her pain, and that's why she's feeling so much better today than she was a year or so ago.
Yes, and James, a lot of talk, as I understand it, in the science community about how this might relate to other diseases and other conditions. Tell us a bit about that.
Yes, exactly. Now, the reason people are excited about this is because it gets to the fundamental cause of lots of different diseases. Now, if we were to think about, say, neurodegenerative diseases, things like Alzheimer's disease or Huntington's disease or Parkinson's disease, which you've mentioned, they all are characterized by the buildup of toxic proteins that, say, damage the brain. So the theory, and it's still a theory at the moment, is that maybe if you can use this same gene silencing technology to lower the levels of those toxic proteins, then maybe you can change the course of those diseases too. And that's why it's so exciting, because it's getting to the fundamental causes of these diseases. And some of them, you know, we don't have treatments for at the moment. Take porphyria. We didn't have any way of preventing those attacks that Sue was having other than a couple of lifestyle changes. But now we're getting to the point where this Nobel Prize-winning science is getting to the point where it's starting to help patients. We'll see now in the future whether it's going to help in a lot more diseases too.
I mean, Sue, you said this has completely changed your life. And you alluded to kind of some of the treatment you were having, morphine-based treatment. What did it do in terms of your lifestyle, job, home, family life?
Yeah, it affects every facet. Yeah, I've got a daughter who's 2, but you are sluggish the whole time, you've got pain the whole time. It impacts on everything. You don't sleep properly, you don't have the energy to be able to do things.
You were hospitalised?
Yeah, there was a lot of time over the years. I was hospitalised. My last big attack was in April last year. I was in hospital for 5 days with IV morphine, which didn't control the pain. I was, in a really not good way. It's scary.
I Yeah, I was certainly
you
good.
go,
Sorry,
go.
I can only imagine. I mean, that moment when you first realised that you genuinely felt different. Was there a moment when you thought, do you know what, this really is working? It was much more gradual.
Yeah, it was much more gradual. The pain I was like, I'm not sure I need painkillers today. And it just gradually happened. It wasn't an overnight switch off. It was a gradual. And I'm in a much better, stronger position. I'm physically stronger, sleeping better, everything, every facet of my life will change.
Talk to me about how employers, how friends react. Because there's always that thing, isn't there? I know you've had a severe condition, but there's always that thing when you say, oh, aching a bit, or, back's aching, and you kind of don't want to be that person,
I end up not really talking about it. I work for the British Porphyria Association, so with those people I talk about it openly. My close friends obviously know, but you just have to try and keep going. You just plough through unless you're in the real depths of a horrendous attack when you're in hospital and you're away from everybody.
So thank you. James, just a last thought from you. Presumably there's going to be a lot of people listening with a lot of interest to this, as we're speaking this morning. Where do you think the timeline on this lies in terms of progress?
Okay, so we've known about this technology for a while. It won the Nobel Prize in 2006, and now in 2019 we're getting to the point where it's starting to help the first patients in a few diseases. It's going to take a long time, I think, really, before we're going to start seeing it applied on a wider scale. But this today really is the point at which we get to say, look, this is a potential new class of medicine that's actually starting to help patients. And in the years to come, and it's going to be years, probably decades, but it could have an impact across a wide range of diseases.
James, thank you very much for your input today. And soon, you can just tell from the smile on your face,
Yeah,
it really does come across.
Really
Thank
good.
you.
Thank you very much.
Good luck.
Thank you.
16 minutes past